Welcome back to the What's in Your Head podcast, Tools for Pain and Dizziness. I'm Pete Schultz, Doctor of Physical Therapy. Today we're talking about vestibular therapy for post-concussion symptoms, what it is, what it looks like, and how it can help you if you're dealing with dizziness, headache, imbalance, visual sensitivity, brain fog, or feeling off after having a concussion. A lot of people who have had concussion get referred to vestibular therapy, and they have no idea what it means. They may picture standing on one foot or doing eye exercises, but it's much more than that. It's really about helping the brain and body reconnect the systems involved in balance, motion, vision, and nervous system regulation. As always, this podcast is for educational purposes only and is not medical advice or a substitute for individualized care. If you have a concussion or ongoing symptoms, make sure you're evaluated by a qualified healthcare provider. So let's get going. What is vestibular therapy? So vestibular therapy is a specialized type of physical therapy focused on dizziness, vertigo, imbalance, motion sensitivity, visual sensitivity, and post-concussive symptoms. It helps retrain communication between their inner ear balance system, which is your vestibular system, your eyes, which are the visual system, and the neck, and the brain, and the nervous system, and all the muscles and joints involved. So when you have a concussion, there's a lot of systems involved, and vestibular therapy helps get them all reconnected and back on track. So after concussion, dizziness does not mean that your brain is damaged. What's actually happening is a communication problem with the vestibular system, visual system, and nervous system, and neck. So you can think of it as a slowing down of all of these connections, and you're going to feel off until everything gets back up to speed. So that's what vestibular therapy does, is reconnect all these systems and get everything back up to speed. The vestibular system is located in the inner ear. So when the doctor looks in your ear, they're looking at the ear canal, and they could see up into the eardrum. The eardrum is also called the tympanic membrane. Inside the eardrum, you have 3 small bones that are used for hearing. You have a cochlea, which is used for hearing. It's kind of like a shell. It's kind of like an echo chamber. And then in between the cochlea and the 3 inner ear bones, you have the vestibular organ. Now, the vestibular organ is made up of 3 semicircular canals that are filled with clear fluid, and they act like accelerometers. So they're responsible for telling your brain where and how fast your head is turning, horizontally, vertically, and diagonally. Then you have 2 pouches that are called the otoliths. These otoliths are also called the utricle and saccule. The saccule is more a vertical organ, and the utricle is more horizontal. And they're responsible for telling your brain where your head is in relation to gravity. So they could tell if you're standing, lying on your back, bending forward or backwards. They're gravity detectors. They could tell where your body is in space. Then you have some cranial nerves, specifically the 8th cranial nerve, that innervates these structures. So if the system is impaired, you're going to feel dizzy, off balance, nauseous. You're not going to be able to stabilize your vision, and it's really uncomfortable. Why symptoms happen after concussion, or some of the symptoms that I see in people after concussion, are dizziness, the feeling of being off balance, nausea, headaches, visual motion sensitivity, fogginess, trouble focusing, neck pain. And this involves several systems. And the systems that are involved are your vestibular system, which we just discussed, your visual system, your cervical spine or neck, and your nervous system. So the vestibular system is made up of the inner ear balance organs, and they often get irritated or they get weakened following a concussion. Your visual system are your eyes, and your eyes may have a hard time focusing or following objects and feel like you're straining or slowed down. The cervical spine or the neck muscles and joints get tight. And sometimes if you had a whiplash type situation with your concussion, these muscles get strained and weak and tight and you lose range of motion. And the nervous system might be thrown into a fight or flight response because it's scary getting a concussion. And then the nervous system goes into this protective state. So you have all these systems working together and they're all affected after concussion. Now, a vestibular therapist is usually a physical therapist who has some extra training after their regular schooling and has experience working with people with vertigo and dizziness. And, there's a couple of different ways to get trained. They work in a facility that has a good vestibular center. There's a lot of good training programs that they could go after their normal education. They have advanced training in vestibular therapy. Now, when a vestibular therapist looks at someone after concussion, we're going to test the balance. So we're going to test your balance with your feet together, with your eyes opened and closed, standing on foam. So what I'm really trying to do here is have everyone understand what a vestibular therapy evaluation and session might look like. Because when a doctor tells you to go to vestibular therapy, a lot of people are like, what is that? They don't really know what to expect. So first, we're going to look at your balance. When we look at your balance, we're going to look feet together, wide stance, one foot in front of the other, eyes open, eyes closed, moving your head side to side, standing on one leg, testing your balance in all these different positions because the vestibular system is responsible for balance. Then we're going to look at how you're walking. If you could walk in a straight line, if you could walk while turning your head side to side, can you turn and pivot? Can you walk over obstacles? Could you negotiate obstacles? Could you step up? Could you go up and down the stairs? And also we're looking at your steadiness and also how you feel. If you feel off or you feel dizzy or nauseous. Then we're going to look at the ability to tolerate motion. So could you tolerate spinning around in a circle? Could you tolerate walking and twisting? Could you tolerate things like bending down to tie your shoe, rolling over in bed? Then we're going to look at your eye movements. So can you track an object with your eyes? Can your eyes jump side to side like in reading? Can you look at something close to you and then something far away, which is called convergence and divergence, or accommodation of the eyes? Then we're going to look at the vestibular ocular reflex. Now, the vestibular ocular reflex is your ability to look at an object while your body is moving or your head is moving because that object is not supposed to move. I always give people the example that like when you run and you're looking at, say you're looking at a stop sign or you're looking at cars on the side of the road, those cars aren't bouncing up and down while you're running and bouncing up and down because you have this stabilizer system in your body called the vestibular ocular reflex, and it suppresses all the motion around you so that when your head is moving or you're bouncing up and down, those objects aren't moving. Sometimes after concussion, this gets impaired and it makes people feel very uncomfortable. With a vestibular therapy assessment, we're going to look at this system and see if you're able to move your head or body side to side while being able to fixate and stabilize an object. Then we're going to look at your neck. I want to look at your neck range of motion, see if the muscles are tender, if you have tenderness in those muscles at the base of your skull or in the front of your neck, if you could hold up your head against gravity or how strong those muscles are. I'm going to look at your posture, some headache referral pattern, and neck proprioception. So neck proprioception is your ability to know where your head is in space based on your neck muscle. Sometimes we'll do things like we'll affix a laser pointer to a hat or on someone's head and have them close their eyes and see if they could return to a target that they were looking at when their eyes were open. So there's different ways to assess your cervical proprioception. And then we're going to look at any type of things that will trigger your symptoms like screens or grocery stores or driving, walking through busy environments, moving your head quickly, and kind of figuring out what causes an exacerbation of symptoms and how to control those. Then we're going to look for BPPV. So BPPV is positional vertigo. That's when the room is spinning. So that's a situation where you have these crystals in your inner ear that are supposed to be in the utricle and saccule, or the otolith organs, and then they make their way up into the semicircular canals, which is supposed to have clear fluid. And if you have crystals in those semicircular canals, when you roll over in bed or you look up or you lie flat, you're going to feel like the room is spinning. So this could be tested with a couple of different evaluation techniques like the Dix-Hallpike maneuver or some of these other tests, or the roll test. The roll test and the Hallpike-Dix test are the two most common evaluation techniques that you'll see a vestibular therapist do. And if these are positive, we treat them with repositioning maneuvers. And the most common one is the Epley maneuver. There are many maneuvers that we use. The Epley maneuver is the most well-known one, and that's for the posterior canal. Sometimes one treatment will dramatically change someone's symptoms. So if you have vertigo, it doesn't take that long to reposition those crystals and get you back functioning like you were before. Oftentimes, I love when people come in and they have BPPV, because I know that we're going to do the maneuvers and they're going to feel so much better after one treatment. The next thing we're going to talk about is vestibular hypofunction. So hypo means low. So this is a low functioning vestibular system. So this means the vestibular system is underperforming. It's not doing its job, where the vestibular system's job is basically balance and your ability to handle motion or to control motion. Symptoms with vestibular hypofunction might be blurry vision with head turning because you're having issues with your vestibular ocular system, dizziness when turning your head quickly, imbalance with walking, especially in dark areas, trouble in crowds, unable to balance with your eyes closed, unable to balance while turning your head side to side, and just generally feeling off. So some of the treatments that we'll do for vestibular hypofunction will be stabilization exercises for your eyes, where you look at an object, turning your head side to side and trying not to let that object move. Head movement drills, so moving your head side to side. A lot of times, people who have vestibular hypofunction don't want to move their head. And if you don't want to move your head, you're going to feel even more dizzy. So basically you don't move your head, and then your neck starts to get stiff, and then it kind of creates another array of symptoms. We'll also do different walking progressions. So we'll have people walk, maybe tandem walk, or walk on different surfaces, walking, turning your head, walking, moving your head up and down at different angles. We're going to retrain your balance. And we do habituation training. So habituation training is basically what I'll tell people to do is do something that makes you dizzy every day. And if you find something, if you bend over to tie your shoe and it makes you dizzy, do it 5 times. If rolling over in bed makes you dizzy, roll over in bed 5 times. So you have to keep doing the things that make you dizzy to strengthen that vestibular system. Because remember, the vestibular system, it's like a muscle, and it gets stronger when you move your head and move your body. Vestibular treatment after concussion is geared towards up-regulating the vestibular system and down-regulating the nervous system. So when we talk about up-regulating the vestibular system, these were all the things that I was just discussing. It means waking that system back up. Initially, this is going to be uncomfortable, and it's going to cause you to feel more dizzy and more nauseous. The vestibular system needs movement, especially movement of the head, and it needs to balance with your eyes closed and with your head turning in order for it to get stronger. Some of the exercises that we're going to do are these gaze stabilization, where you're turning your head, focusing on objects, walking with head turning, walking with head nodding, walking with diagonal head turns, maybe holding a ball in front of you and tossing it side to side and moving your head, doing things like if you're a basketball player or a soccer player, you're kind of kicking a ball, you want to be able to follow that ball with your head, moving your head side to side. You want to be able to balance. And habituation exercises are doing all the things that make you dizzy and forcing yourself to do that. So you're gradually exposing yourself to these things that make you dizzy, and that's going to strengthen your vestibular system. We do this in small doses, and it's always a gradual progression. And then over time, over the course of a few weeks, your vestibular system adapts and it gets stronger and works harder. The other part of this is down regulating the nervous system. So down regulating the nervous system, a concussion is scary, and the nervous system doesn't like concussions. Your nervous system's always trying to protect you, and many people become more sensitive to movement and getting back to normal activity. It's scary having a concussion. Your nervous system is trying to protect you. You're going into fight or flight. You're having a lot of sympathetic nervous system reactions, right? And symptoms may escalate from things like stress and poor sleep and anxiety and overstimulation and feeling like the symptoms won't get better or fear that the symptoms won't go away. And some of these treatments that help down-regulate the nervous system are going to be breathing exercises, especially extended exhale breathing, where you're breathing in and then you breathe out twice as long. So the exhale is usually that relaxing breath. We do biofeedback and measure heart rate variability or measure muscle tension. We can measure a couple of different metrics while doing breathing and self-regulation exercises to make sure you're really down-regulating that nervous system. We do some mindfulness exercises like somatic tracking and some pain reprocessing. We do grounding exercises where when you're feeling really overwhelmed and stressed about the concussion, you're focusing on different objects in the room or feeling your body, your feet touch the floor. Pacing is just kind of gradually not overdoing it. When you go back to work and you go back, you can't just jump right into where you were before, whether you're going back to sports or going back to work or going back to social activities. And we do this through graded exposure. And lastly, it's education about the symptoms, really. And that's why I do this podcast, basically, because education and knowing what a concussion is and what a concussion isn't and understanding your vestibular system is less scary, makes you understand it a little bit more. A lot of people come to me after they're reading some forums or chat groups online or Reddit or something like that. These forums and rooms are great initially because kind of they get you to the right place, but everyone's concussions are so different. So it's kind of hard and it's really scary. So we really have to kind of calm that nervous system down. So let's talk about how the eyes and neck tie in. So the brain uses three systems to be in equilibrium. Equilibrium is the state that our body strives to be in. And these three systems are your vestibular system, your visual system, and your neck. These three systems need to be on the same page. And if these three systems disagree, you're going to get symptoms. So if you have a disagreement and your vestibular system is telling the brain something differently than the neck or than the eyes, then it creates a mismatch, and that commonly results in dizziness, headache, nausea, fogginess, and feeling disconnected. We need to get these symptoms on the same page and talking together, and we do that through vestibular exercises and vision exercises and neck exercises and down regulating the nervous system. Two people could say, I'm dizzy after concussion. One may need BPPV treatment where we do maneuvers to reposition the crystals. One may need neck physical therapy. One may need vision therapy. One may need vestibular habituation. One may need nervous system down regulation or self-regulation exercises. Some people might just need graded exercise program. That's why an individualized evaluation from a healthcare provider who specializes in concussion really matters. And like I always say, no two concussions are alike. So it's really not a great idea to compare your concussion symptoms with someone else who had it, because a lot of times I'll have people come in and they say everyone else had a concussion, they got better 2 weeks, or I have a cousin that had a concussion and it took him 2 years to get better. Every concussion is different, and you shouldn't be comparing your symptoms to someone else's. In the concussion world, we always say once you've seen one concussion, you've seen one concussion, because they're all just so different. Oh, it's really important to know not to compare your symptoms to someone else or anyone else who's had concussion. So that's where the chat rooms and the Reddit groups get a little dicey. So if you're dealing with dizziness, headache, or feeling off after concussion, know that recovery is possible. And often the answer is not simply waiting longer. Sometimes the right testing and the right rehabilitation plan can make a major difference. Vestibular therapy can be one of the missing pieces because it helps retrain balance, motion tolerance, vision, neck function, and the nervous system all together. If you'd like to learn more about pain, dizziness, headaches, or vestibular recovery, you can visit painanddizzy.com. And if you're looking for physical therapy or vestibular therapy evaluation, go to dynamicsportspt.com. Thanks for listening to the What's in Your Head podcast, and I'll see you next episode.